Good afternoon, everyone, and welcome to our Don't Get Bent Out of Shape Tips for Improved Musculoskeletal Health workshop brought to you by Univera Healthcare. I want to start out by thanking each of you for taking the time out of your day to join us here today for our sixth webinar, part of our Understanding Your Wellbeing webinar series that we launched in 2025 for our Univera Healthcare members. It is hard to believe that we are already almost halfway through the year, but once again, we have appreciated all of our members that have attended and or maybe engaged with any of the recordings of the monthly webinars that we have facilitated so far this year. My name is Katie Keller-Burgess, and I am part of the Wellbeing team here at Univera Healthcare. I will be the host for today's forum, teeing up our guest speaker, Bill Chien, who will be presenting the majority of the content for today's webinar. So a few housekeeping items to start us off with here today. First off, please note that today's webinar and all of our 2025 Wellbeing webinars are being recorded and are being housed on our Univera Healthcare YouTube page. So if you need to go back and re-listen to this webinar or maybe access a previous webinar that you were unable to attend, once again, you have on-demand access to those monthly webinars directly on our Univera Healthcare YouTube page. Another housekeeping item that I do want to call out is that all participants' microphones and cameras are automatically disabled. There will be time at the end of the webinar for questions with Bill. So I recommend if you do have any questions at any point throughout today's webinar, to please enter them in the Q&A feature. So at the top of your team's webinar, you will see a Q&A icon. So once again, at any point throughout today's webinar, enter your questions in there, and at the end, we will get to any questions with the remaining time. And the last housekeeping item is it is important to note that the content covered here today is simply meant to be educational in purpose. So if you do have any specific health-related questions or concerns, we of course recommend to be connecting with your primary care provider. Or if you have any specific benefit-related questions or concerns relative to your plan, we do recommend that you call the customer care number that's located on the back of your Univera Healthcare insurance card. All right, so with the housekeeping items out of the way, let's go ahead and learn a little bit more about today's guest speaker. I have the pleasure of introducing Bill Chien, who is one of our physical therapists, part of our member care management team. Bill has a doctorate in physical therapy, a master's in health and human performance, and a bachelor's in health services. He has been a practicing physical therapist for over 10 years and started his career as a traveling physical therapist in Virginia before working in an outpatient clinic in which he was an assistant facility manager. He then started his career here at the health plan in 2018 in utilization management, where he did utilization reviews for physical therapy prior to transitioning to the case management team that he is part of today in December 2023. Bill and his wife Amanda reside in Buffalo, where they have a 3-year-old daughter and have their 2 golden retrievers. And in his personal and spare time, he enjoys camping, fishing, and working out, which of course is the perfect tie-in to today's webinar topic of just movement really in general. So Bill, we are so thrilled to have you with us here today. I will turn the stage over to you.
Thank you so much for that introduction, Katie. And thank you again to everyone that's joined the webinar today. I first just want to kind of point out some things that I'll touch base on today. So the agenda, the musculoskeletal system and injury prevention, I'll touch base on. I'll give you some facts on spine and back health. I'll give you also tips for proper posture, ergonomics, and body positioning. I have a list of stretches as well. I might be able to show you one or two, but we'll also have a QR code that you'll be able to scan with your phone to see a longer list of them. And then at the end, I'll pass it back over to Katie to go over related benefits and resources. All right, so before we get going and get into the agenda, I wanted to do a little icebreaker and take a quick poll to lead us into those topics. So there'll be 2 poll questions, but we'll launch the first one now. So on average, how many muscles are there in the human body? So once you go ahead and click one, you hit submit, and then we'll kind of keep track of all the answers. We'll give it like 30 seconds or so that everyone has a chance um, to answer. All right, we got a few responses so far. We'll give it a couple more seconds. So we got some 400, some 500, and then we have over 600. All right, I think we're almost there. Got 26. All right, so there are actually over 600 muscles in the human body. Actually, there's actually roughly 30 muscles in each foot and each hand alone. So that's 120 right there. All right, and then the next poll question we have is just to kind of get you thinking about normal aches and pains that you might have had throughout your life. So have you ever experienced any of the following MSK aches or pains? Back pain. You can choose multiple as well before hitting submit. So back pain, carpal tunnel, meniscal injuries, neck pain, plantar fasciitis, rotator cuff injury, any kind of sprain or strain, such as an ankle sprain, tendonitis, and then there's a section for other or none. Again, we'll give it a few seconds to, have your ability to go in and just select, whatever you've dealt with throughout your life, essentially. All right, I think we got a lot with back pain and neck pain. Got some tendonitis out there, plantar fasciitis, meniscal injuries, carpal tunnel. All right. So it looks like out of this poll, majority have had back pain at some point, followed by neck pain. And I think that's pretty common. I think you'll see with just that a majority of us, if not all of us, have dealt with some kind of MSK pain in our life. Thanks again for participating in that poll, just to get us kicked off. All right, so what I'm going to start with is some musculoskeletal health. All right, so MSK system is the body's support structure, made up of bones, muscles, cartilage, ligaments, tendons, and joints. The skeletal system has several jobs, some of which are easier to see and feel than others, but they're all important to your body and health. Your skeletal system's major functions include giving your body shape, helping you move, protecting your organs, creating new blood cells, and storing minerals. Your skeleton supports the weight of your body, but it's also the anchor for all the tissues that connect to it. Your joints, connective tissue, and muscles all work together to push and pull parts of your body every time you move. The human skeleton is like a built-in suit of armor for organs throughout your body. So your skull protects your brain, your ribs shield your heart and lungs, and the vertebrae in your spine keep your spinal cord safe. Bone marrow at the center of some of your bones produces new red blood cells and white blood cells your body needs to stay healthy. And your bones hold your body's supply of important minerals like calcium and vitamin D. All right, so some MSK conditions, they can cause pain that affects your bones, joints, ligaments, muscles, and tendons. And I think as we saw earlier, almost everyone has experienced MSK pain at some point. And this risk actually increases with age. You may experience pain discomfort, stiffness, sleep disturbances, and/or mental health problems. And this pain can limit your mobility, range of motion, and overall quality of life. So next we're going to talk about musculoskeletal injuries in a little bit more detail. Believe it or not, the majority of musculoskeletal injuries are the result of a strain or sprain. Now, a strain is an injury to the muscle or tendon, which is what attaches the muscle to the bone. Muscle strain is an overstretching or partial tearing of muscle fibers. Some common symptoms of a muscle strain include pain, swelling, muscle spasms, and limited range of motion. Now, the severity of symptoms can vary based on the grade of the strain. So grade is 1, 2, 3, or mild, moderate, or severe, where a mild or grade 1 involves few muscle fibers being stretched or slightly torn. Moderate involves partial tearing of muscle fibers. And then a grade 3 represents a complete tear or full thickness tear of the muscle. I apologize if I use my hands. I'm married to an Italian, so it's just really natural for me. A sprain is an injury to a ligament, which is the piece of connective tissue that connects bone to bone. A sprain is a stretching of or tearing of ligaments, and like strains can be varied based on severity. Same thing, grade 1, 2, 3, or mild, moderate, severe. And it follows the pretty similar pattern of how they're graded, where grade 1 is a slight stretching and some damage to the fibers of the ligament. Grade 2, partial tearing of the ligament, causing prolonged pain and swelling. And then grade 3, complete tear of the ligament leading to significant instability. So example, ankle sprain, very common. The most commonly sprained ligament in the ankle is the anterior talofibular ligament, the ATFL, and that's usually due to an inversion injury. I personally dealt with many of these when I played football and soccer, to the point where my mother stopped believing that I was spraining my ankle until later I broke my ankle and they showed slight stress fractures throughout. So I think she felt a little bit bad after that. But either way, I'm just pointing out that it's very common, and this specific one accounts for 85% of all ankle sprains. An overuse injury occurs when tissue is damaged due to repetitive demand over a period of time. So an example of an overuse injury could be tendonitis for rotator cuff or Achilles, tennis or golfer's elbow, shin splints, runner's knee, or patellofemoral syndrome. All of these are examples of an overuse injury. Now, MSK injuries can occur for a variety of reasons and can be classified based on severity, as previously discussed, and also categorized based on when the injury occurred. So acute, subacute, and chronic. Acute is often defined as lasting less than 4 weeks, subacute 4 to 12, and then chronic often means the pain is lasting for more than 12 weeks and or is recurring over time. And I just wanted to point out that treatment, such as going to a PT, can sometimes be dictated by how long since that injury occurred. So if it's an acute injury, a lot of times there might be a lot of swelling that can kind of slow any kind of strengthening or anything else, because we usually try to take care of that first. All right, next we're going to go into some spine and some spine health and back pain, a little bit of facts and statistics. Low back pain is the most common musculoskeletal problem globally and is one of the most common reasons for missed work. I know we saw earlier in the poll that that was the number one MSK injury that people have dealt with over their life. In fact, back pain is the second most common reason for visits to the doctor's office, outnumbered only by upper respiratory infections. 8 out of 10 adults suffer from back pain at some point in their life, whereas 1/2 of all working Americans admit to having back pain symptoms each year. Most cases of back pain are mechanical or non-organic, meaning they are not caused by a serious condition such as inflammatory arthritis, infection, fracture, or cancer. And 9 in 10 acute low back pain causes end within 6 weeks. The spine has excellent memory, and as such, it's recommended that you take care and provide it with proper support from a young age. Controlling your posture, engaging in strengthening, as well as stretching are all beneficial to long-term health of your spine. All right, next, I wanted to give you some ideas on how you may be able to prevent some of these MSK injuries. Firstly, don't skip warm-ups and stretching. Stretching improves flexibility and allows you to perform your daily activities more easily. Before you start an activity, warm up with dynamic stretching. Dynamic stretching mimics the movement of the activity you're about to start and gets your muscles ready for that movement. After your activity, make sure to statically stretch. Now, static stretching is when you get into a stretch position and hold it for a specific period of time, improving flexibility and range of motion. I think when most people think of stretching, they think of static stretching. Um, and as you'll see with some of the exercises near the end of my presentation, those are all static stretching, but most static stretches can be turned into dynamic stretching. Next is prioritizing strength training as at a young age, or as you age. Strength training can build and maintain muscle mass, which will stabilize your bones, joints, and spine. It can also play a role in slowing bone loss, decreasing the risk of injury. Additionally, core strengthening and balance exercises improve stability, allowing for increased mobility. Next, practice mindful movement and ergonomics. So pay close attention to how you move during your daily activities. Whether you are reaching, bending, or twisting, move with intention to avoid straining muscles and joints. For example, if you're lifting a heavy object, use the strength of your legs to slowly lift the object to reduce the strain on your back. If you work at a desk, choose a chair that supports your spine. Keep your screen about arm's length away, and keep your feet flat on the ground or slightly under your chair. And then lastly, practice good posture. I know we'll get into a little bit more depth with this later on, but having good posture can help you avoid common aches and pains in your back, neck, and shoulders. Maintaining healthy posture can reduce wear and tear on your joints, especially in your neck and spine. Good posture may not be able to completely prevent joint issues like arthritis, but it can reduce the stress on your joints and help alleviate common symptoms such as upper back pain, neck pain, stiffness, headaches, and more. All right, next we're going to talk through improving MSK health with posture ergonomics tips and additional considerations. All right, so first of all, what is posture? Well, posture is the natural way you hold your body. Your MSK system maintains your posture. All right, now that we know what it is, why is it important to have good posture? Well, having good posture can help you avoid common aches and pains in your back, neck, and shoulders, as previously stated. Maintaining healthy posture can reduce wear and tear on your joints, especially in your spine. And although you can't completely prevent joint issues like arthritis, it can reduce stress on your joints. And just to give you an idea, sitting hunched over puts about 200 pounds of pressure on your lumbar spine. And because slouching puts pressure on your bladder, poor posture can lead to urinary incontinence when one coughs or sneezes. All right, now that we know some benefits of good posture and some issues we may experience with poor posture, I wanted to share some tips to encourage better sitting and standing posture. Now, we'll start with sitting posture. First of all, I want everyone to sit up nice and tall. Keep your ears, shoulders, and hips in a vertical line. It's suggested that you don't cross your legs. And I know some chairs have like a built-in lumbar support, but if not, you can roll up a towel and put it right in your low back. That'll help support your low back and help with the natural curvature of your spine. And then, as I do with all my employees, you should stretch and walk around after about 30 minutes of sitting. It doesn't have to be exactly 30 minutes, but as long as you're getting up and walking around, just to minimize the amount of time you're sitting in front of a screen or just sitting in general, will certainly be beneficial. Now, it's not expected that someone will have perfect posture all the time. However, it's just good to be mindful of what good posture is. For myself, when working with patients, I use a mirror for visual feedback. That way, because sometimes it's just hard to know if you're not sitting upright. You know, sometimes just this cueing, you see yourself in a mirror, you can kind of sit up nice and tall, shoulders down and back. But again, it's just a way to give yourself some feedback. So for me, I started in a clinic standing mostly. And when I came here, it was a big difference because I was sitting majority of the day. And of course, I wasn't listening to my own advice that I give patients, and I wasn't doing all of these things. I think it only took 2, 3 months before I developed severe neck pain. And then I'll give you some one of the exercises that I did a lot that helped me and resolve that neck pain. But it just shows that, you know, a big change like that or sitting for long periods of time certainly can affect you, whether it's your neck or back or anything else. All right, now next, these are just some tips for standing posture. Again, stand up straight and tall, keep your shoulders down and back, activating your mid and low trap. A lot of people are raise their shoulders up, again, even while sitting. But really, we want to work on the mid back with normal posture. Just helps with stability of your overall spine. You want to keep your feet shoulder width apart, and then your weight mostly on the balls of your feet rather than on your heels. You can also put one foot on a low box or stool and switch feet every few minutes. That just balances out where the weight and your spine is throughout the day. All right, next I wanted to share some tips for the physical movements and activities that we often do throughout a normal day. So let's start with proper lifting mechanics. It could be picking up kids, laundry basket, pretty much lifting anything. Now, this is something I would do essentially with anyone that had low back pain in the clinic. Before I got them discharged, I would go over proper lifting mechanics because I felt like this was just something that if they didn't know how, they could wind up back, you know, in my office or having to go to their doctor or anything else. So I always had them, you get nice and close. Well, first of all, you should always check the weight prior to trying to lift it, just to make sure that it's something that you would be able to lift, or knowing the weight. Otherwise, you would want to get a partner or some help assistance to carry that or lift that. Getting nice and close, feet shoulder width apart, shoulders again down and back to help with stability. You want to bend at the knees and use your legs to do the work, not your back. And then I also wouldn't want you to twist, because again, that puts a lot of pressure on your lumbar spine and your spine in general. I would always have you use your feet to move rather than to pick up something and then twist right away. Also, you want to apply the force in a smooth and consistent pattern. Don't do it real quick or jerking motion. All right, now let's talk about tasks that involve pushing or pulling. Maybe a grocery store cart, a baby stroller, or a lawnmower. You always want to try to push items as opposed to pull when possible, as the pushing position places your back in a more mechanically safe position. So again, with pushing, you want to check the weight first, make sure it's something you're able to do without assistance. Again, shoulders down and back, apply a smooth and consistent pattern when pushing. And again, obviously you can't push everything. There's some things you have to pull. This is just more letting you know or giving you education on if you're able to push rather than pull. All right, and then finally, let's talk about carrying items. This could be grocery bags or a child. When carrying items such as a load of grocery bags in from the car, make sure to keep the bags close to your body in the safe zone and have your elbows bent as to engage your biceps and help disperse the load from your shoulders directly. Again, check the weight first. Don't twist while carrying the objects. Keep the bent. Carry item between hip and shoulder height. All right, here are some tips to help reduce injuries and improve MSK health for sleep, footwear, and accessories. So I want to start out by saying if you sleep soundly and wake up without pain or stiffness, then whatever sleep position is that you're doing is working for you. This is again just kind of tips if not. So side sleepers, consider putting a pillow between your knees. Back sleepers, you can slightly elevate your legs by putting a pillow under your knees or calves. Stomach sleepers, like myself, cause the most stress typically, but if it is preferred, then you could put a pillow up near your hips. Again, it's if you're dealing with any kind of pain or stiffness when you wake up. Otherwise, whatever you're doing is working for you and continue to do it. All right, for mattresses, medium firm usually best, but everyone's different, so just listen to your body. And then just make sure you flip or turn your mattress every couple months. For shoes and footwear, what you wear on your feet can have a big impact on your back. So try to limit high heels and flip-flops or flats without any arch support, as this can lead to mechanical issues of the foot and ankle, and that'll travel up to the knee, hip, back. So really, it's very important. Having cushioned inserts and soles is always best. I also want to recommend a transitional period for any type of new sneaker and increased activity. And if you're standing often, having an ergonomic cushioned mat to stand on, or a slight foot elevation through either a step or a box can help alleviate some back pain. High heels change your spine's mechanics and can trigger foot, leg, back, or even neck pain. Also, you're more apt to trip, fall, and or roll your ankle. And hard to believe, but your accessories such as a purse or wallet can have an impact on your back as well. So for purses, make sure to clean it out. You don't need 5 to 10 pound purses. Keep it light. Crossbody purses are preferred to disperse weight amongst the shoulders and upper traps. But if using a single strap purse, try switching shoulders frequently. Wallet, similarly, clean it out, keep it thin, switch between each pocket, front or back, side to side, so you're not constantly using the same shoulder movement to reach it, to get it in and out. Also, if you're sitting on it, your body will naturally turn and create additional stress on your back. So again, you just want to move it around, kind of even it out. And then one last thing, it's not on the slide, but when using a phone, try alternating sides. If it's, if you don't have a headset, headset's obviously preferred. But I remember seeing a lot of in the clinic, people that had jobs that they had to be on the phone, they developed neck pain, especially if it was always constantly one side. All right. Next, let's talk about a few common terms that I'm sure most of you are familiar with, mobility and flexibility. So mobility refers to the ability to take your body through a range of motion before being restricted with control, and it's dynamic. Mobility is essential to your overall quality of life, essentially as you get older, because it is really your ability to move and comfortably perform daily activities without restriction or pain. Well, flexibility refers to the ability of your connective tissue, such as your muscles, ligaments, and tendons, to temporarily elongate. Flexibility is also important because when your body is restricted and you're unable to move through your natural range of motion, pain can occur. Both mobility and flexibility are very important and require active participation by you in your life to keep these at a good range. One of the best ways to keep your mobility and flexibility is through active stretching and dynamic movements of your body parts. I like to refer to the phrase, if you don't use it, you lose it. All right, now these aren't all of the benefits of stretching, but I wanted to kind of just show you that there are a lot. Um, just increased range of motion, relieves muscle tension, stress relief, improves posture. And again, I know it's stated before, dynamic stretching before physical activity can help prepare your muscles. All right, so I'll pause here for a couple minutes. This is the exercise list that I had talked about earlier. If you scan the QR code that is up on the screen, it should bring you to a spot to view all of these exercises that are listed in a video format. Now, most of these exercises can be turned into dynamic stretches. However, I wanted to be consistent when they were being filmed, and I also chose exercises that mostly don't require any kind of equipment. Now, the one I know I'd mentioned earlier that I wanted to show you at least one exercise, as it's one that's helped me, and it's one that I've essentially showed all of my family that have dealt with any kind of neck pain. It's the first one, it's a chin tuck. It's also called the cervical retraction. It's a great exercise because, and maybe it might not necessarily be deemed a stretching exercises, although it does stretch some muscles. It works the deep cervical flexors in your neck, helping with posture. So essentially, if you're sitting, you would draw your chin straight back, creating a double chin, and holding for a length of time, generally 6 to 10 seconds. Again, it's working these endurance deep cervical muscles in the front of your neck, but it also stretches the posterior aspect of your neck. which is why I threw it in there. I think this is great because you can do it sitting, you can do it standing, you can do it laying on your back, you can do it. I do it in the car when I'm at a stoplight. Again, for that tactile feedback on the back of my head, you could do it up against a wall too to make sure, because some people have a tough time knowing if they're doing it correctly. Again, the videos, it does kind of go through what it should look like with a description. So I encourage you to grab that QR code and take a peek. All right, and then just wrapping up. So just a few things I want everyone to take away from this presentation is to be proactive, not reactive. So again, prevention is key. Be mindful of your posture and body positioning when performing everyday tasks, as this can help reduce risk of injury. Incorporate regular movement throughout your day. And then I love this. What is the single most effective exercise you can do to help reduce the likelihood of back pain and really kind of any pain? It's the one you actually do. And with that, I will pass it back over to Katie.
Bill, thank you so much. That was so great. A couple of the key takeaways for me is that I really should no longer wear high heels, and I'm not going to argue with that. So, great takeaway. But also, I am somebody, when you mentioned the carrying of items, I will not make 2 trips from my car into my house with my groceries. So, that includes a lot of, carrying being done. So, thank you for the tips there to help ease that burden from maybe my shoulders as well. So great information once again. I hope everyone was able to take a few nuggets away, personally for yourselves as well. But as Bill mentioned, I'll plan to take the next couple minutes to review at a fairly high level some additional related benefits, tools, and resources that you may have available to you through your Univera Healthcare membership. So I do want to call out that the benefits that I will review here do vary by contract, and the availability of them, once again, does vary. So to confirm if a program mentioned is available to you, we do recommend either logging into your Univera Healthcare online member account or calling that customer care number on the back of your health insurance card. So to start us off here, the first benefit and program that I want to provide an overview for is Vori Health. And this is a virtual physical therapy option for members that have this benefit available. So through Vori Health, you are being able to get a treatment plan designed personally for you, specializing with Vori Health providers, including doctors and physical therapists that are really specializing in muscle and joint conditions. So much of what Bill discussed here today. So that can include a virtual physical therapy treatment plan. It could potentially include nutrition counseling, healthy lifestyle coaching, and more. So, of course, any recommendation if you are experiencing aches and pains is to connecting with your primary care provider. But if physical therapy is a potential treatment option, virtual physical therapy, once again through Vori Health, may be a great option. For someone like myself who has a young child at home, in-person physical therapy might not work the best for my schedule personally. So having a virtual option is something that really, once again, may be a great benefit to you as a member if available and a good fit. So I do want to call out that, once again, if available to you, the cost for Vori will vary based on your member-specific contract, but once you log in and schedule an appointment, your member cost share will be provided to you, so you are well aware prior to actually scheduling and or utilizing the services. Now, the next tool and feature that I wanted to review is our Find a Doctor tool, as well as the cost estimator tool that is available through our Univera Healthcare member portal. So once again, if you are someone who is looking for physical therapy and looking to find in-network providers, our Find a Doctor tool can help you really filter down, because you can filter by specialty. So if you were to start typing into the search bar within the tool, physical therapy, once again, it will populate a list of participating providers that you can filter by, whether the provider is accepting new patients, if they speak different languages, if they are wheelchair accessible, and more. So our Find a Doctor tool, once again, a great resource to be able to find in-network providers that are relative to what type of care you are looking for. On top of that, the cost estimator tool is another great tool and resource to be able to utilize as a member. As once you are logged in, it is going to provide you estimated out-of-pocket medical cost specific to your plan, based on your year-to-year spending and potential deductible. So, based using this tool, you are able to get estimated costs for over 1,600 different treatment categories, as well as 400 plus procedures. So, once again, really helping you become a better consumer of your healthcare plan, especially if you are on a high deductible health plan and looking to see what potential costs could be incurred for you as a member. Now, the next benefit that I want to highlight here is our member care management team, which Bill is a part of, along with some other colleague physical therapists. So, our member care management team is inclusive of a variety of healthcare professionals, such as physical therapists, as well as registered dietitians, registered nurses, respiratory therapists. And really, this team is all here for our Univera Healthcare members whenever you need us, from little questions to potentially big health challenges. Our care managers can provide support as well as personalized guidance for all of our members of all ages at no added cost. So, really, a value add to have this additional care team, if you will, helping to provide you guidance and support, as we recognize the healthcare plan and just world can be confusing, right? So you can see here based on this slide, you can connect and engage with our care management team through phone call. You can also engage with them through the WellFrame app. And this is a free app our members can download. You can see to receive personalized guidance, support, and that care plan for potential conditions such as anxiety, depression, maternal health, stress management, weight loss. So once again, if interested in connecting with this care team for additional guidance and or support, you can download that free WellFrame app, set up your account, and directly through there, you can be texting with your care manager for convenient, flexible access to that additional layer of care. Do want to call out that access code you can see here on this slide is Univera Welcome, all lowercase, all one word when registering for WellFrame. And then perks for you, if you are not familiar with it, is a great benefit available to our Univera Healthcare members that offers exclusive discounts and deals on healthy programs, products, and services at local vendors throughout Western New York. So once again, we encourage you to log into your online member account, click on that Perks View link under that Health and Wellness tab to view a listing of any participating vendors and have access to those deals and discounts. And then last but not least, quickly here before getting into the Q&A, some of our members do have access to the Vitalize Wellbeing platform through our partnership with Personify Health. So this platform is providing our members an engaging way to hopefully help support healthy behaviors, whether that be physical activity, healthy eating, trying to maybe better manage stress, aren't we all? But once again, a great platform to be able to help build upon those healthy behaviors, help you stay engaged, maybe some friendly competition with coworkers that have it available as well. So once again, this program does does vary by contract. So once again, log into your Univera Healthcare online account to see if available to you. Now, with that being said, once again, thank you. Wanting to get directly into this Q&A for any that we had come through. So once again, encourage you, if you haven't had the chance and have a question, please go into that Q&A icon and enter it. But I will start us off here, Bill. First question that came through, are push-ups bad for your wrists? What are your thoughts around that?
All right. So really, obviously depends on what's going on with you personally. But there are a lot of variations to, again, most exercises, especially push-ups. So if doing a normal push-up bothers your wrists, it might be a good idea to, either see a PT or, talk to your primary. But you can do it on incline or at the wall. I personally don't like doing push-ups because it does bother my wrists, but I don't have a lot of range of motion and I have nerve tension. So again, it really depends on the specific person. I wouldn't say they're necessarily bad, but they might be more difficult, more painful, depending on, whatever specific is going on. Like if you have carpal tunnel, could increase some tension there too. So again, there are variations. If a normal push-up causes too much discomfort, you could do it on incline, like on the edge of a countertop, or even at the wall. The farther back your feet are, the harder it'll be.
All right, so unfortunately, push-ups should still be in the repertoire for many, is what you're saying, but options to at least help to make it for a potential wrist pain. Good to know. Thank you.
Mhm.
Next question that came through: if starting a treatment plan with a physical therapist, how long, on average, would you say does it take to see any improvement?
All right, so this will vary obviously based on the person. So the biggest thing I would always tell my patients is it really is on you, because going to PT once or twice a week isn't necessarily going to, you might not see a huge change, because they should be giving you a home exercise program that you should be doing daily, once or twice a day, or whatever they gave you. So to see improvement, a lot of times it's on you. I would say, I know research has shown that if there is zero improvement and you're truly doing all of your home exercise program, if after 5 visits, research does show that they should reevaluate and see either what needs to be changed, or see if you need to be referred out. But again, a lot of the onus is on the patient doing the exercises, because again, if you're only doing them when you're in the clinic, we normally know if you're not doing them right, or if you haven't been doing them. So just be really good about doing your exercises that you're given.
Awesome. Thank you, Bill. Next question is about the QR code. So I will go back to that slide. I believe it was for the stretches, is what you were looking for. So, yes, great stretch videos that Bill has done. All of them listed here. But if you scan that QR code, it'll bring you to that YouTube link. And I know my colleague Kate Berry also put it in the chat. Um, this one, very interesting, Bill. Obviously, many of us from Western New York here and the dreaded S word of snow. So while we are in summer, any tips on just shoveling snow that you can recommend for any of our participants that are doing so in those winter months?
Yes, I'm glad it's summer, first of all, and I do not like to shovel snow when I don't have to. I would say yes, there are plenty of tips. I know there are certain shovels that make it easier. They're not necessary. It also depends on the weight of the snow. So I would always try to limit the amount you're trying to shovel, first of all. Also get close to it, stagger your feet, don't twist, just like we were talking about with lifting. Um, Let me think. Yeah, I mean, realistically, do what you can, do it slow. If you do things fast, it can result in, increased strains of your back or hip or anything else. So, again, do it slow. Try not to twist. Use your feet to move. Use your legs, not your back. So all the similar things that come with the proper lifting mechanics.
Awesome. All right, just based on the interest of time, we'll do one more. So, Bill, in your opinion, is it better to rest a sore back or move? Essentially, does the motion help heal?
Depends on what's going on. But so there are something called DOMS, or delayed onset muscle soreness. So it could be from something that happened a couple days ago and you're just feeling the soreness now. Again, it really depends on what the cause of the pain is. It might be something you could work through if it's normal soreness, but that should be instructed by the PT or your doctor. I generally, if it's sharp shooting pain, I would rest. Not, I don't like pushing through pain, because pain is there for a reason. It's telling you something's going on. And I always recommend ice over heat, because ice essentially is good for everything. People like heat, so they usually don't like when I say that. But if there's any kind of like nerve involvement, it could possibly flare up nerves too. So again, go with ice, and talk to your doctor to see whatever specific is going on with you.
Awesome. Thank you so much, Bill, for all of your great insights, information, and expertise here today. We appreciate it. Thank you all for attending here today. We appreciate your engagement once again in these monthly well-being webinars. And just a quick push if you haven't registered for our June or July webinar. It is actually going to be facilitated by myself, and the topic is the miracle of movement. So myself as an athletic trainer, previous physical personal trainer, will kind of be going over just the importance of movement, how to best build it into your day, the basics of strength training, things along that nature. So once again, QR code here if interested in registering for that webinar. But as mentioned, all of our webinars are recorded, housed on our YouTube link. I know once again, my colleague Kate is placing in the chat that YouTube link as well. So with that being said, thank you all once again for attending. Thank you, Bill, for presenting, and we hope to see you at next month's webinar. Have a good day, everyone.
Thank you. Take care.